that's problematic to close, then you can predetermine where you want to apply the pads. Normally, I'll be about at least 5 centimeters away from the wounds where I apply these, and then also about 5 centimeters. So it might be simple to go, you know what, I want one here, and here. So knowing in advance where you want to put your particular pads is quite useful and reduces making a mistake. So what I normally do then is take, this is the 3M vet bond, I'll take off the protective membrane. You don't want to use excessive amount of glue, but add a few drops. And I usually use the back of the membrane and just kind of spread this out in this fashion. And then apply the first one. We'll put it up here, and Nick, if you can kind of push down on that for about a minute. Go to the next pad. Glue. Just gently spread it around. Apply it there. As you can see, Dr. Trout is an excellent assistant. Maybe not. And again, you can just use it to feather it over the surface area. We'll apply that one right here. Thank you. And you could also apply pads cranial and caudal if you think there's some advantage or gain there.
Blendet noch.
And then the last pad, which I can hold out. Thanks, Nick. So usually in a otherwise skin, if it's dry, this will adhere usually in about 40 to 60 seconds. So as I apply them, I have an assistant just kind of pushing down, holding onto those. The same thing here, keeping these in place. So it looks like they may hold enough. Then I'll take the cable, a pair of scissors, if I could give you those. So then you stretch it from one to the other, cut off the excess cable. Yep. Same thing here. And that's really as simple as it is. So if you have an open wound in this area, again, you can use any type of wound or dressing there. And underneath that, you can then use these to actually help hold the dressing and when if you need to change them for another day or two. And then the cables come back down. Now what I'll generally do is, let's say I apply these at 8 o'clock in the morning, I'll apply them under tension. I'll go back around, 12, 1 o'clock. I'll free it up. I'll put a little more tension on it. Then I'll go back a little later in the day, do the same thing. And then eventually what will happen is in about 48 hours, most of the skin is going to be gathered up. And then you can go ahead and turn under anesthesia, remove your cables. Take your pads off. You've already clipped and prepared the skin, so all you have to do is take a surgical preparation, drape it off, and then complete your surgery. Simple as that. The axial pattern flaps, I think I'll just point out a couple anatomic features. maybe going over here, and then you can go ahead and outline the flap yourself. Normally you want the leg, we could maybe back off a little bit with the camera.
You can move the camera wherever
Okay,
you
that's
go
good.
to be.
Make sure the leg is a natural, relaxed extension. You can feel the acromion is right here in this dog. The spine of the scapula is right here. So that's the first mark. If you feel right in this area, the shoulder depression, part of the triceps coming up here, but you can feel where the muscle belly ends. And then all you need to do then is measure with a ruler. Oh, great, thank you. So from the spine of the scapula to that shoulder depression, in this case, is about 4 or 5 centimeters. And you can double that distance. In this case, we'll say 5 centimeters. And then you can draw a parallel line to elevate the flap to the dorsal midline or to the dorsal midline or beyond. The vessel comes out above the acromion, parallel to it, in about this direction. And this is where you would see the vessel normally form. And underneath the skin, you'll see it branch or arborize in this area. So this is a very simple flap to use. Very effective. When you elevate these, you can see you can rotate them to close shoulder defects, thoracic wall, and you can bring them down to close the elbow region, either interior, posterior. Also, as we talked about, the axillary area, the flap can be curled around and placed in this vicinity. Now, the last point, let's take a look at the abdominal wall. This is a female dog. I think if you could hold that leg back for me just a bit, thank you. Here's the midline of the abdomen. Does that show up? Let's see. I wonder if you could rotate that leg back a little bit. Here's the midline of the abdomen, and then the distance from the mammary teat to the midline would be approximately here. So there's glands 1, 2, and 3, and I would normally try to end the flap about right here. So this is 6 centimeters from the midline to the mammary teat, and then additional 6 centimeters coincidentally comes out right about here, and the flap comes back in this location. So this entire flap right here can be elevated to close wounds on the same side of the thigh. If we could back up just a little bit. So the flap can be rotated to the inner thigh, to the knee, can be rotated to the flank area, can be actually used to close wounds on the opposite side. So if we had a defect in this location, you can use the opposite axial pattern flap to rotate over to close this area. And the flap, gently curved, can be used to reconstruct the perineal area. This is the vulva right here, but can be used to actually reconstruct that entire region. Very versatile flaps. These are two of the easiest and most versatile flaps that you can use. So without further ado, why don't we go ahead and you can come into the lab and start outlining the flaps yourself. Thank you.
Other questions?
Sure, I can step out and answer questions. Are there any questions regarding those? Yes.